Laparoscopic gastric bypass is the most frequently performed weight loss procedure in the United States and has been around a long time. The first procedure was performed in 1967 using an open technique. It's now usually performed through several small incisions. Gastric bypass continues to withstand the test of time. Considering overall effectiveness and risk, gastric bypass still sets the standard by which other weight loss surgeries are compared. All weight loss operations, gastric bypass, sleeve gastrectomy, and gastric banding involve a restrictive component, meaning the size of the stomach is reduced so less food can be taken in. Gastric bypass differs from other weight loss surgeries because it also includes a malabsorption component. In gastric bypass, a portion of the stomach is sectioned off with a line of staples, creating a new, smaller stomach pouch. This new stomach pouch is about the size of an egg. The residual stomach is not removed. It continues to function and could be used if revisional surgery is necessary in the future. Just like in plumbing, this new pouch needs an outlet in order to empty. To achieve this, the small intestine is divided just beyond the duodenum, and a connection is created to the new small stomach pouch. This connection is called the Roux-en-Y. The new Roux-en-Y limb of the intestine bypasses the duodenum and proximal jejunum, where calories are most effectively absorbed. Gastric bypass causes weight loss in two ways. Less food can be taken in, and fewer calories are absorbed. Every surgery has risks, and the laparoscopic gastric bypass Roux-en-Y is no exception. We discuss risks not to frighten or discourage you, but to inform you. Your surgeon wants you to make a good decision based on facts. When you come to our office for your initial evaluation, we'll conduct a very thorough exam and history. We want to discover any potential medical problems and address them prior to surgery so that we minimize your overall risk. The Weight Management Center began performing laparoscopic gastric bypass surgery in 2001, and our physicians are very experienced performing this surgery. However, anytime a surgeon staples, divides, and connects the small intestine and stomach, there are risks. These risks include bleeding, leakage from the staple line leading to potential infection, and stricture, or narrowing of the connection. The chance of not surviving the surgery is about 0.5%. There are also some potential complications associated with the operation, including vitamin and mineral deficiencies, anemia, and malnutrition. Despite the risks, overall, gastric bypass remains the gold standard in weight loss surgery. On average, patients lose 65% of their excess weight following this procedure, which is higher than the weight loss expected from the gastric band and sleeve gastrectomy. In addition, there are no post-operative adjustments associated with the Roux-en-Y gastric bypass, which is required with gastric banding. Our goal is to reduce your health complications or comorbidities and improve your overall quality of life, including your social interests, psychological well-being, and employment opportunities. Laparoscopic gastric bypass is an excellent tool to help meet those goals.